So before that, I want to talk about arthroscopic reconstruction of comminuted glenoid fracture using a distal tibial allograft results in excellent postoperative outcomes. These are our disclosures. Acute fractures of glenoid are challenging to treat. Usually it is associated with a shoulder dislocation.
That's why it's so close.
Oh, sorry. A little bit, I'm so nervous. Yeah, so
You're doing great.
Thank you so much. Deep breath in. Alright, that's okay. So usually it is associated with shoulder dislocation and injury with the chest and spine. CT scan is preferable to more precisely capture fracture pattern and also rule out chest and spine injuries. Patient had glenoid fracture because of shoulder dislocation episode or high energy trauma. Heidelberg classification type 1A with anterior glenoid ring fracture with anterior shoulder dislocation is the most common fracture pattern. In surgical treatment, open and arthroscopic surgeries are selected. However, open surgery has high complication rates with neurovascular injuries. In arthroscopic surgery, arthroscopic reduction and internal fixation using endo-bottom with arthroscopic fracture fixation and arthroscopic anatomical glenoid reconstruction using distal tibia allograft are both selected. This study was designed to analyze radiographic and clinical outcomes with arthroscopic fracture fixation using endo-bottom and arthroscopic anatomical glenoid reconstruction using the distal tibia allograft for type 1A anterior glenoid ring fractures. Since 2013 and to 2021, a total of 41 patients had anterior glenoid fractures surgically treated. 3 patients had open surgeries, and a total 12 patients had arthroscopic fracture fixation using endo-bottom. A total of 26 patients had arthroscopic anatomical glenoid reconstruction. The primary outcome was radiographic outcomes, including glenoid width, fracture pattern, and progression with arthritis. Secondary outcomes are patient-reported outcome measures with Western Montreal Shoulder Index (WOSI) score. At baseline, there were no differences in age, BMI, and glenoid bone loss. The average waitlist time before the surgery was 2 weeks for arthroscopic fracture fixation versus 4 weeks for arthroscopic anatomical glenoid reconstruction. The comminuted fracture pattern was significantly higher with arthroscopic anatomical glenoid reconstruction with 70% cases. In results, the postoperative glenoid width measured with anterior posterior length of the glenoid has been improved between groups and quite comparable between groups. There was no progression to arthritis with the joint space narrowed between groups. The WOSI scores have been improved in both groups and quite comparable between groups. In discussion, arthroscopic fracture fixation using endo-bottom and arthroscopic anatomical glenoid reconstruction using distal tibial allograft have comparable radiographic outcomes with improvement with glenoid width, no progression with arthritis. Also, patient-reported outcome measures have been improved in both groups. A difference between groups exists with the glenoid fracture patterns. In arthroscopic anatomical glenoid reconstruction, more cases with comminuted glenoid fracture fragment pattern existed. In consideration that clinical outcomes are quite the same between fracture fixation and glenoid reconstruction using distal tibia allograft, when the fracture fragment is comminuted, arthroscopic anatomical glenoid reconstruction using distal tibia allograft should be selected. And when the fracture fragment is a big one bone block, arthroscopic fracture fixation using end bottom should be selected. In conclusion, fracture fixation for anatomical granary ring fractures with arthroscopic anatomical granary reconstruction using distal tibia and arthroscopic fracture fixation using end bottom have similar radiographic and clinical outcomes with improvement with glenoid width and no progression to arthritis. Surgical decision-making should be based on the fracture fragment pattern. If comminuted, arthroscopic anatomical granary reconstruction. If one big bone block, arthroscopic fracture fixation with end bottom. Thank you very much.